Okay.
All right, everybody, here we are. We are good to go. I am Sharon Addison, and of course, representing the Caribbean Medical Mission of New Jersey. And of course, our endeavor is to serve the needy. And what we've been doing a series of interviews, and we hope that you will find it quite interesting. And this particular interview is with one of our very own doctors, Reynald Altema. See, I wanted to say that in French because I know you parlez-vous a little bit of Francais. I'm not even going to do that. So we're going to make it just nice and easy for those of you who are tuning in. And of course, you can always go to our website, which is cmmonj.org, which stands for Caribbean Medical Mission of New Jersey.org. All right, so Dr. Altema, welcome on in.
Well, thank you for the invitation.
Oh, listen, we've been having a lot of fun having these interviews, and we know that you are an internist, right? But I'm going to have you tell folks a little bit more about yourself and how it came about for you to be a board member, I may say, right?
Board member? That's correct.
All right, for the medical mission. And also we're going to talk about something that's very important to a lot of the men in our lives. So if you have an uncle, a dad, or somebody that you know, you really will want to share this or take a listen on in. So Doc, tell us a little bit about yourself, where you're from originally, and the floor is yours.
Okay, thank you. Of course, I was born in Haiti, and I came to the US when I was about 16, so I finished all of my schooling here in the US. I went to undergrad at the City University of New York, and I graduated in 1976. So I'm not exactly a young buck.
Okay.
And then after that, I went to medical school at the State University of New York in Brooklyn, downstate. Once I graduated from medical school, I went to New Jersey to do my training. And in fact, that's where I met Dr. Winston Scott, who is the president of CMM.
The current president, yes. Mm-hmm.
And we've been friends ever since. So it was only a matter of time before I would join CMM because we were good buddies. And he told me about this nice activity that was going on. And it was right up my alley because I believe in helping others to help themselves. So that's how I got involved with CMM. And from the very first time that I went to a mission in Jamaica, every year, unless something beyond my control were to happen, I have been going. And I miss it very dearly because this COVID business has turned our lives upside down. Mm-hmm. So this year, we couldn't go.
Yeah, that's we call these trying times, and a lot of people, they're saying if they could turn back time, but you know what, it is what it is, but this is considered our new norm.
That's right, it is what it is.
Yeah. So, one of the things that I wanted to speak to you about, and it's about men's health and really about prostate, making sure that they're taking care of themselves, they're getting their prostate check. And because it seems as if, statistics, I don't have all of them here, but I'm sure you can shed a little light on it, that African-American men and Caribbean men are more likely to have issues or, with prostate cancer or even die from it. So can you just speak a little bit to that?
Indeed. Prostate cancer happens to be one of the conditions that afflict us disproportionately. In plain English, it means that if you were to look at the different ethnic groups and you put blacks, be the black person, be from the Caribbean, from the US, or where have you, and you were to compare that group to European, people from Asia, and so on and so forth, and you would see that we stand out. We stand out because we have the disease more often. The disease tends to be more aggressive among us. And it also means that a lot of us are dying from it. So now, when you look at Blacks as a whole, and you pinpoint where you see the highest incidence, the Caribbean stands out. Unfortunately, Jamaica, and we are not sure why, Jamaica stands out. So it is a disease that concerns all of us, and it's a disease that we need to take very seriously, because if you catch it very early on, you could make all the difference in the world. And if you wait till it has already propagated, then you're playing catch up, and usually it's not a war that you're going to win.
So a lot of men, and it's not just maybe Caribbean men, we don't know, they seem somewhat a little bit uncomfortable when you talk about them getting their prostate checked. So how can you explain it to folks who might be listening in and they have some reservations, like, I don't know if I want to go get that done? Can you just explain to them as nicely as you can? You're a doctor, you know.
Of course.
Go about and get it.
Okay. Mm-hmm. Let's talk about the elephant in the room. Basically, the average male hates the idea of having to have a rectal exam done. That's basically what it boils down to. Okay. The good news is the following. There is a blood test that has been in use for more than 20 years that has revolutionized the way we approach the disease. Now, when we're talking about screening for prostate cancer, there are two methods available. One is the dreaded rectal exam, where the doctor with the index finger feels the outline of the prostate, looking for growth and so on and so forth. Obviously, besides the fact that a lot of men don't feel comfortable having that exam done, they just don't. The limit of that exam is that you can only check for part of the prostate. So now the second available screening method is a blood test. So for all practical purposes, the blood test will suffice as a means of screening men for prostate cancer. So to all the men out there listening, just know that we can screen you by just having a blood test. I'm not saying that there is no place for the digital rectal exam. I am not saying that, but I'm just saying for the purpose of screening people and knowing how much they dislike having the rectal exam done, we have another means, which is the blood test.
So, and thank you for explaining that. Dr. Altema, now for when people are asking, you know, at what age is it best for a male to get their prostate checked? Now, if they have family members who might have had prostate cancer, should they go earlier? So can you give us a ballpark age when would be best?
Right. Usually the age of 40 is the cutoff date, where we say from 40 onward, every year you should have the blood test done.
Okay.
Now, let me backtrack a little bit and say that you might hear or read people say that screening for the prostate is an overrated exercise. I will say that in Black men, that is not true. The opposite is true. We need to screen because so many of us have it, number one. Number two, the disease is so aggressive that it makes sense that we should be screened. So if in a family, your father had it and other people had it, you want to be careful. You want to get yourself checked as early maybe as in your 30s.
Yeah.
Because I have seen men younger than 40 develop the disease.
Wow.
That's correct. It happens. Now, obviously, the older you get, the more likely you are to get it. But it could happen also in your 30s.
So, you know, even as a nurse, I do know, but I just want you to even educate the audience a little bit more. What are some of the signs that, you know, when it comes to people having issues with the prostate, and sometimes you don't know, but what are some of the things they should be concerned about?
Okay. When you start having difficulty passing your urine, that is a concern. When, for example, you have the urge to go, but you, for some reason or another, are having the greatest difficulty letting the stream go down, that is a concern. If you ever see any blood in your urine, you ought to be concerned also. Hold on 1 second, please. My phone is dying on me. Hold on, please.
Okay, no problem. Well, folks, as you can see, this is so important. It is so important that we definitely make certain that we get this information to our loved ones, our family members, because like the doctor said, that it's a runaway train. After, if you let this go, we don't want to have any issues. So even though it may be uncomfortable, maybe talking about it, wives, maybe you need to speak to your husbands, family members, definitely the people that you care about, start to have these types of conversations, because it can really, truly save lives. So there you are, Doc.
Yes, indeed. Yes, indeed.
Right. So we were talking about some of the signs and symptoms and the
right. Now,
stuff. Yeah.
The fact that you have those symptoms does not necessarily mean you're dealing with cancer of the prostate.
Right.
What it does tell you is there's an issue with the prostate and you need to have it checked. So let's go over that again. If you have difficulty passing your urine, if you have a burning sensation when you pass your urine, or if you find yourself constantly going, but each time you go, you only let out a little bit. And last but not least, if when you have the urge to go, you can barely hold the urine, you got to rush, otherwise you're gonna have an accident. All of these are telltale signs that there is an issue with your prostate. So you need to go and have yourself checked. What we don't want to see is when you cannot pass urine, period. When your bladder becomes distended, becomes full. That is the one symptom we dread, because 35, 40 years ago, when we did not have the blood test to screen people for cancer, and the only thing we had available was a digital rectal exam, men were not getting themselves screened. And unfortunately, the way we would make the diagnosis of prostate cancer would be when the man presents with just an inability to pass urine. I mean, I'm talking about you cannot pee, period.
Wow.
That's right.
They have to end up at the hospital and.
That's correct. That's correct. This is bad.
So so, you know, we're going to wrap this up, but I want to thank you, Dr. Altema, for really taking this time out to educate and to speak to our audience. And one of the questions I want to ask you now, just if somebody's, saying, okay, I'm going to take my husband in, or they're going to go and get checked, do they have to go to a specialist, or can they go to their regular doctor? Some people wait until it's time to go to the emergency room, but can they go to their regular doctor, or do they need to go to a specialist right away? Because I've been asked that. So
Very good. That's a very good question. Usually your family physician is the one that does the screening. When there is an issue, he or she will refer you to the urologist. The fact of the matter is that there just are not enough urologists available to be the one to do the screening. So the screening is done generally by family physicians. And when there's an issue that goes beyond their expertise, then they refer you to a urologist. Now, I also want to say that having a problem with the prostate does not necessarily mean that is cancer, because you may have an enlargement of your prostate that of itself is causing problem because of the location of the prostate so close to your bladder that whenever it's getting bigger than normal, it's pushing against the bladder. But again, the idea is that whenever there's an issue, get yourself checked. That's the one thing we need to remember.
Yeah.
Number one. And number two, even before it gets to that, you should have yourself screened, especially if there's a family history of prostate cancer.
Okay. So at the age of 40, and if there's a family history, possibly earlier. Now, when we speak of the prostate, sometimes we say, okay, people are concerned about the colon, so it's a colorectal cancer, and it doesn't mean, folks, that every time you're doing that, it's only for cancer. They're saying by the age of 50, for most men to have their get a colonoscopy, or can you just speak to that a little bit for us?
Oh, yes. Again, just like prostate cancer, colon cancer is unfortunately common among people that look like you and me. And the same thing goes true. You, in families, when there's a history of colon cancer, you need to be concerned. In fact, I will come right out and tell you that I'm a colon cancer survivor, because when I had my colonoscopy done, I was just beginning to have something develop.
Okay.
Had I not had it done 22 years ago, I wouldn't be here today talking to you. So these things happen to real people. So yes, it can happen to me, it can happen to somebody else. Anybody is susceptible. So for colon cancer, the way we screen is to do a stool test. In fact, there's a test now called the Colo-guard, where you just set a piece of the stool, and then it's pretty accurate, and it detects for any blood in the stool, whether you see it with your naked eye or not. And then there's the colonoscopy, which is done as a screening. And all of these tests, again, we're not talking about when you have symptoms. We're talking about screening, because you take a population of people where you feel that the disease is so common that it makes sense that you look for it. You don't wait till the person has symptoms. By the time you have symptoms, it means that if there's something there, it's pretty far advanced.
So folks, there you go, you heard it. Now we're talking about men, and we're gonna have you come back, Dr. Altema, because the ladies too, they're gonna, well, what about us? So,
well, let me give you a preview.
Please, yes.
What about you ladies? Okay,
Yes, because I know they're asking now. Now they're leaning in and they want to know.
Okay.
Spill the tea, Dr. Altema. Spill the tea. Go right ahead.
In families, sometimes what we observe is that the men get prostate cancer and the women get breast cancer.
Hmm.
So what I'm saying is these two problems concern all of us. Why? Because if you're talking about a female getting breast cancer, that person may be your mom, your sister, your cousin, your girlfriend, your wife. Or if you're talking about men getting prostate cancer, that person could be your husband, your brother, your father, your cousin. Do you see what I'm saying?
Yeah.
So it's not a matter of only men need to be concerned about prostate cancer or only women need to be concerned about breast cancer, because we are like that. We are one into the other, and we have relationships. And a lot of times the female is the one that handles all the health care in the family.
True.
She goes to see the physician, she likes him or her, and brings her mother, her father, her husband, her brother, etc., etc. So it's all of us concerned.
Yeah.
And the way if we realize it that way, then it's no longer an issue that this is only something that should concern a
We're
woman.
all in this together.
That's right. We're all in this together. That's right.
Wow. Well, Dr. Altema, I thank you so much.
Anytime.
We got an opportunity. I see you have some birds in the background there. Told you this interview is a very, just easy breezy. I just want people to get the information, because when people, they talk about the prostate, they're so uncomfortable. Some people get a little squirmish. Some people don't want to say the word, all of those things. But we just wanted to bring you this information, folks. And like the doctor said, we're all in this together. Once again, I'm Sharon Addison, and this is Dr. Altema. He's also an author. We'll talk about that on our next interview. But
okay.
Of course, you can always find us on the World Wide Web. We are on Facebook. We are on Instagram. We are on Twitter. We are Caribbean Medical Mission of New Jersey. And our website is cmmonj.org. That's cmmonj.org. You can find a lot of information about us. You can see about us, and you'll see another picture of Dr. Altema. He writes some really great articles for our blogs along with other members of the organization. Once again, I'm Sharon Addison. I am a registered nurse, but I love doing all of this, Dr. Altema.
Right on.
Yes,
right on.
And it's a great way for us just to educate the public and to bring you this information. So if you have a loved one, remember, we're all in this together. Let us start to take care of ourselves, because you only get one you. Until next time, everybody, we'll see you again. Take care now. Bye-bye.